afternoon, everyone. My name is Kieran Sampson, and I'll be hosting this webinar on behalf of ARACI today. Thank you for joining us for this really important topic. We really hope it helps you to help all Australian children and young people to thrive. Before we begin, I'd like to acknowledge that we live and work on lands whose sovereignty was never ceded, and acknowledge the deep connection Aboriginal and Torres Strait Islander peoples have to country and community throughout Australia. We pay respect to elders past, present and those yet to be. ARACI supports the Uluru Statement from the Heart, and we seek to see our children thrive. Children are central to the Uluru Statement, and through meaningful dialogue, change can be driven to build a better future. We are open to change. Responsive relationships built through dialogue and positive interactions are crucial to developing healthy brains and healthy lives. We acknowledge a history of displacement can have intergenerational effects, contributing to adverse experiences for children and families. Supporting and modelling respectful dialogue in the community will promote connection and engagement to deliver improved outcomes for children and families. ARACI hosts webinars to share information and promote discussion across a range of topics. We welcome the opportunity to highlight the research of others and centre the voices of those with lived experience. Through these webinars, we seek to grow capability and knowledge across the sector. During this webinar, your mics and cameras will remain off for the session. You'll be able to add questions for our panellists via the Q&A in your control panel at the top of the Teams webinar window. You can post questions at any time, and we'll have time for a discussion and answering questions towards the end of the webinar. The webinar is being recorded, which will be made available on the ARACI website and via our YouTube channel. For over a decade, the Frameworks Institute has been at the forefront of groundbreaking research in Australia, exploring how communication strategies can shape public perception and action on issues concerning children and families. Today's webinar is an opportunity to hear their insights and learn more about leveraging framing for maximum impact. It's my pleasure to introduce you to our panellists today, Annette Michaud and Naomi Brown. Annette is a Senior Fellow with the Frameworks Institute. She's passionate about championing changes to the way policymakers, advocates and practitioners communicate about children and parenting in Australia. And Naomi is the Senior Partnership Officer for the Strategic Framing Initiative at Thriving Queensland Kids Partnership, one of ARACI's major initiatives. Naomi works closely with stakeholders to guide them in shaping public communications and policies using frames and narratives that contribute positively to outcomes for children and young people. Over to you, Annette.
Thank you so much. It's lovely to be here with you all, and I hope you're noticing that I'm colour coordinated with my slides. And I just say to the back office team here, if please interrupt me as I go along, because I can't see everything that's happening on my screen. So it's wonderful to be here. Thank you so much. And I would like to acknowledge that I'm on Gadigal land, close to the beautiful ocean in Sydney's east. It's a beautiful part of Sydney, and it's a balmy 30 degrees today. So it's lovely to be coming to you from this beautiful place to be talking about our children and our families and how we can support them to thrive today. I'll spend about 30 minutes talking about framing and how you can use framing in your daily efforts, both as an individual, as an organisation, and part of a community. Be really useful just to know, first of all, how you or where you are up to with framing. So we're just going to activate a little poll. Anything from you're an experienced framer, you've been using the frames for a while, through to this is your first encounter with a webinar or a training session on strategic framing. So we'll just watch how that goes in the chat. And I'll see if I can, as I'm talking to you, see what's happening. If not, I will ask my trusty colleagues to
Annette, it looks like we've got lots of newbies. At the moment, we're just over 50% are new to framing.
Oh, fantastic.
And about 34% say they are familiar.
Right. Well, that's incredibly useful to know. Thank you for that. And if you're new to it, I hope it has a similar kind of aha moment for you that it did for me when I first heard Frank Gilligan talking about framing. I think he first came to Australia in about 2004, and I was just incredibly taken and have since then been very, very passionate across the organisations I've worked for around framing and how it can be a very important tool to help us communicate effectively. So, just wanting to talk a little bit very briefly about our agenda today. Firstly, I'll go through some of the core concepts, particularly for those who are new to it, but also it's always good to have a bit of a refresher. Some recommendations from the Australian framing research that I think you'll find useful. We've got my wonderful colleague Naomi Brown, who's right in the thick of it in the Queensland context, working with a fabulous community of practice where they are really implementing the frames, and the frames are only ever as good as their implementation, of course. And then we'll just give you some wind-up practical tips and resources to think about and go away with. So the first thing is that framing is all about the choices we make in what we say, how we say it, what we emphasise, and what we put into the background. And these choices actually profoundly shape how the Australian public thinks and feels and indeed acts on our social issues. So what we say profoundly affects how people think and how people act. So framing actually plays a massive role, a significant role in social change. And way back in the 1920s, the kind of king of public opinion research, Walter Lippmann, said the way which the world is imagined determines at any particular moment what people will do. So how the world is imagined and talked about determines what people will do. The way the media, leaders, advocates, our CEOs frame issues shapes how the public sees the world, and frames affect whether we see issues as important, a public issue or a private issue or a shared social concern. One example that we see a lot in the child and family sector is that kind of charity framing, helping the needy, individuals who deserve our help, versus more of a justice frame where we think about what's fair as we set up society, and more of a systems focus. And just want to show you a couple of really interesting charts here. This is from some Canadian research that was done a few years ago around alcohol and other drugs using some classic frames. And I just want to show you how, to emphasise how these different choices have different effects. So the vulnerability frame goes something like, people need our help, particularly those who are less fortunate. We need to have compassion and empathy for those that are using drugs and provide services that support them. Conversely, the social prosperity theme is really around building a more prosperous society through providing supports to people. Now, guess which one got the support of the public? So what this shows is below the line is bad and above the line is good. So statistically significant number of people in the public sphere, so the general public, if you use that vulnerability frame, actually get turned off our social issues, so are less likely to support us. So it's a frame that we have to be very careful about using. And I will come back to this when I talk about othering shortly. So the vulnerability frame has been used a lot in the US as well. And some recent US framing research is showing that this actually leads to public support for youth issues plummeting. So not a frame we want to be using. And when you look at our materials, our websites, you see that this frame is in about 95% of our communications still. So that's something we can look at kind of straight away. But I also wanted to show you some Australian research. So this is looking at framing and support for action around parenting support. We all know how parenting is absolutely central to children's outcomes. You can't get good outcomes for kids unless you support their parents. But this is really showing you what's important is the way we talk about parenting. If you start with parents and what they need, and I worked at the Parenting Research Centre for 10 years, the first 5 years in which I was there, we hadn't done this research, and we went out there and talked about effective parenting all the time. But guess what? You can see again in this chart that actually completely turns people off. They walk away from support for our issues if we talk in that frame. So they're less willing to pay additional taxes for policy, and they're less willing to get involved in our issues. So they'll walk away if we use that frame. Conversely, if we start with children and what they need, talk about children's development and how to help them thrive, and parenting support is one of those ways, guess what? It's statistically significant that people support our framing and our policies if we start with children and what they need. So another top tip from this is always start with children and what they need to thrive.
What comes to mind when you think about parenting?
Love, joy, caring.
Love and support.
Yikes.
It's a nightmare.
Disaster.
Parenting is very hard.
The responsibility of raising a kid.
Responsibility?
So it's a lot of responsibility.
What does it mean to be a good parent?
I don't think there's such thing as a bad parent. I think we're all doing the best we can.
I don't think there's a obvious right or wrong way.
Can we sort of say what's good and what's bad? Everyone has their own values, their own beliefs.
There's not a rule book. There's not like a textbook for it.
I think it's just basic. Love your child, provide.
If you care about your family and your kids, just stick with what your gut instincts are, and that's good.
Good parent, giving them discipline.
Discipline is one thing.
I think it's raising a child up with boundaries.
Just watching over them, making sure that everything is sweet.
Give your kids the tools to get through life.
Teaching them things they need to know for later in life.
What are the things that influence how somebody goes about parenting?
Part of it comes from their own parenting or lack thereof.
Probably the way they was brought up.
I'm guessing their own upbringing.
The way your parents were, you seem to follow suit.
Well, they're a good parent because they've actually made an effort to do it. If you've decided to take it on, you've got a responsibility to do it.
Parenting for each individual.
Okay, I think you've got a few insights there. What we're finding there is when you think about the kind of frames people are using, the way they're thinking about children and parenting, it's very much about that individual parent and the choices they're making. So that kind of individualistic approach, how you were parented dictates how you will parent, which is quite a fatalistic kind of view. And there's not much about the community and what surrounds parents and how that actually helps or hinders parenting. So it's very individualistic, and it's just about kind of caring. If you just care and make the choice, you'll be fine. So it's that's the kind of framing we had before we gave people a tool to think about parenting in a more productive way. And so, as I said before, the choice is in how we present ideas. So Emily, the interviewer, was talking about what does good parenting look like? How can we raise children well in Australia? Meant that people went to kind of very common cultural mindsets that we have in Australia. Now, this next clip, and I might shorten it a bit just in the interest of time, also gives us some insights, but it's after people have been given a metaphor, an analogy, just a couple of sentences to help them think about parenting within a broader context. It's called the navigating waters metaphor. And so Emily has just given people this couple of sentences, and you can see from the responses how it's drawing out more productive ways of thinking, because we don't have just one way of thinking or one opinion. We have many, and our job is to bring forward more productive ways of thinking that are going to support our social policies. So we'll see if we can hear this one.
What does the analogy tell you about the things that influence the way that people parent?
Life is very tumultuous, and especially if you have a child to care for.
You may have some rough seas.
And there will be those storms, where you think, well, this is it, I can't get out of this.
Yes, I think, there are rough seas along the way.
What are those rough seas that rock the boat?
Anxiety and stress affects people's ability to parent and children as well.
Completely did not think of this, but I completely agree that it's social situations,
The emotional stress.
The unknown, very much depends on the psyche and the character of the child as well.
If a parent loses their job, or a father loses their job, or whoever is providing for the family, and it's out of their control, you know, that might be considered a very big wave.
If you've got no money and no job, and you're going to struggle.
A different cultural background, yeah, discrimination, poverty, stress.
Different life stages, things that might happen to you, like marriage breakdowns.
But there are also those supports of lighthouses and harbours that you could go to, you know, when you hit those stormy seas, little retreats that you could lean on for support.
Are there things that could improve parenting in Australia?
You need to enlist people to help you, and, you know, hopefully you're not on that boat alone.
Any sort of help and support on the world would be good.
Creating more of a community around it.
I guess if you get more crew on your boat.
But if you do have the right tools and support, it'll make it easier.
If you're living in a community, though, that has good environment, everything around it is good. You know what I mean? Where people are going out to work and everyone gets along better.
Creating those lighthouses is just a reminder to people that there could be supports available.
Family or support from society or support from the government.
Support groups. There should be communication education.
Or maybe people could just get their boats together, you know, and navigate together through the ocean.
So look, aren't people clever? Like, if we give them an effective way of thinking about a social issue, they can talk about the context in which parenting happens and the kind of supports and solutions that might help people find those lighthouses and safe harbours of support. So we've gone from the first videos where people are going parenting up, it's just about caring and love, to people having a much more sophisticated understanding because we've given them a metaphor, an evidence-based metaphor that helps them think about our social issue in a very productive way. So hold on to that thought. This is from Australian research, and we do have a toolkit that takes you through how you can do this as well. And I should just say that the American guy has been living in Australia for 30 years, so that's why we did include him.
What does
The theory of change, really, though, so how do we catalyse this change, is really about giving people a more effective way to communicate, actually having a way of talking about children and families and young people in a way that's effective, that we can then have a much more productive discourse with the public where we are starting to get them on board with policy changes that we want to see. So it might be free universal childcare, it might be something around health and wellbeing in rural communities. If we're changing people's thinking, we can sustain change beyond a political cycle. So this is a kind of a deeply embedded way of getting social change that sticks. So communicating differently to get public support for our issue, to change policies and have those change policies stick. Moving now to some of the mindsets that can really get in the way of some of our communications. And you heard some of these in those snippets. I'm going to focus on otherism because these things are really what we're up against. But I think in working with children and families, that kind of vulnerability, disadvantage, othering frame is so strong in my communications and probably your communications that it's one we really, really need to tackle, I think. Those children over there, those vulnerable families, those children at risk over there living in those communities. This language is at epidemic levels and it's not productive. What I would say about the other mindsets, just briefly, the individual mindset about parenting being set, about parenting being something that kind of happens and parents make individual choices. That navigating waters metaphor, the metaphor that helps people understand that when life storms hit, we need to provide safe harbours, really gets people out of that individualistic frame. Fatalism is a big one that's happening quite a lot in Australia, where we talk about a crisis in housing, a crisis in childcare, a crisis in aged care, tsunami of older people. Really worried about that one because I'm getting older. What that does is just gets people turning off from the message. They just walk away. So we have to be very careful that we don't buy into that kind of crisis language without giving people a pragmatic kind of solution. Otherwise, they will walk away from our issue. So what does othering do to thinking around child and family support? For the public, it feels like that's a problem that occurs over there, not in my family, not in my community, not in my neighbourhood. It's not our problem. It's for those people. Because it's a crisis and nothing seems to change, there's no point in investing in it. So there's very low support for our policies if we come from that kind of frame. It might raise awareness, but it backfires because it really reinforces stigmatizing that group and dehumanizing whole groups of people. And I think that's seriously problematic for us if we're doing that, and we are doing that. So how we fall into that trap, stop and reflect for a moment about your communication, and perhaps in your organisation and your website, if you're doing this, are you talking about disadvantaged and vulnerable groups, and what impact might that have? It certainly removes agency, and when we talk to people who have lived experience, that's the last thing they want. They are active participants in their lives and they have a stake in changing things. But if we're removing agency by labelling them, that is not helpful. Language like them, those, and they, look out for that language in your conversations and in your communications. And treating people as a uniform group, talking about a group as at risk, or talking about young people involved in the criminal justice system is probably not helpful. Now, I don't want to pick on the New South Wales government at all. I know there are government people in the room today, and this is just an example I just pulled off about child protection and wellbeing. It's a great heading because it's including wellbeing, which is saying child protection is about prevention and having supports in place for families, etc. But on the website, it's kind of just a list of things that other children and families who might be experiencing issues around abuse and neglect. And it also tells you that these, what's the effect of abuse and neglect? It feels very static that, you are at risk of these things and it will be who you become, and it really does other people. And there's nothing on wellbeing on this page. It's right up there in the heading, but there's nothing about wellbeing there and what wellbeing means. So this is pretty typical communication, and we're all doing it. So it's something we really do need to change. So how do we counterbalance otherism? Well, collectivism is the way to go. And to cue collectivism, we need to be able to show how we're doing things together. So how communities can come together and be lighthouses of support for families. Show how interdependent things are. Have pronouns that talk about us, we, and I, rather than they, them, and those people over there. So really simple, but changing our pronouns can be much more inclusive. Emphasise common experiences and common goals, and show parents, children and young people as active characters and as contributing to community, as out there in the community. So have them as characters in the community, not just kind of a face of a child or a young person under stress. And this is a lovely example from UNSW. They're talking about Grace Tame's work. And the first quote is where she's talking about how a community is getting together to initiate change and the resources they need to be empowered to make those changes. It's a very strong message of hope. And the second part talks about what we can all do. She's looking to change laws right across Australia and unify laws, and what we can do to sign. We can sign the petition and get involved. So it's a really lovely piece of communication around hope and activism and collective response. So worth thinking about, how's otherism coming up in your work, and what opportunities are you to use some of those other countervailing mindsets to really reduce that othering. I'm moving to part 2 now, and I'm sorry for the glitches in part 1. And this is all about what's happening in Australia. There's been some wonderful work happening over the last few years, and this slide's just acknowledging Parenting Research Centre, the Centre for Community Child Health at the hospital in Melbourne, Children's Hospital, Telephone Kids Institute, Emerging Minds. All these organisations with a vast network of partners have been doing some really important work around a story we can now tell that's effective. Very brief slide on methodology, the first step is to map the terrain in this space. So how do the experts or the sector think about child and family issues? So really getting that down on paper and comparing it with how the public thinks. So those on the street voices was giving us really vital data about the message we were trying to put out there versus what's being heard by the public. And then the second step is to develop and empirically test effective ways of communicating about our policy issue. And the third bit, which is absolutely the most important bit, is implementing the changes in our communication, which is what Naomi is going to talk about. So how do we advance our communications? Well, we have now got a comprehensive strategy, and I really hope that from this webinar you'll go away and have a look. But some of the key messages from that strategy and key takeaways are to talk a lot more about healthy development and well-being and what it takes. So start your communications about children by talking about development and learning and how that actually improves health and well-being. Talk about children and what they need first before talking about parenting. Do you remember what I was saying earlier? And those slides about effectively talking about children is about talking about children first. So always putting children first in your communications and then going to your next point. Tell stories like Grace Tame did about collaborative action to support children and families. What can we do together? The public need to hear about stories of success. If they keep hearing how hard it all is and that nothing's changing, they will walk away and they won't support the policies we want to put in place. And absolutely talk about children and young people in the context of the community and social structures in which they lived. So using this evidence-based communication strategy that has been tested in Australia is really important. So where do you go? The core story for early childhood learning, development and learning is a fantastic resource on the Thriving Kids Institute website. We've got those resources at the end, but it's based on this partnership with Telethon and many, many others. Some of you are in the room, and resulted in e-learning, fantastic toolkits. Mine's all scrunched up because I use it all the time. It's written all over. Beautiful toolkits that you can use in your everyday communications. And it is based on rigorous framing research. I'll just go to an example of what the story actually is. So the core story in essence is saying that for Australia's children to thrive, we need to support their development and learning from conception onwards. This improves their health and well-being both now and throughout their lives. Now, unpacking that, being really clear about it being about health and well-being, that language of health really gets Australians on board. They get that children need access to health services and their development needs to be healthy no matter where they live or who they are. So that's a really important finding. And why does it matter? Because no matter where you live, children should have the opportunity to be healthy and well. We've really focused on now and later. Our early research talked a lot about investing, the benefits of investing in children. This latest research has shown the public find that that's a bit too distant. So we need to talk about children now and how important their development is now, not just for their future, but for now. And the problem being lack of supports disrupts development, and that we need to support each child according to their needs. So it's not carte blanche, everyone gets the same thing. The public understands that's not what we want. We want something that meets needs. Really quickly, because I'm starting to run out of time. This is fantastic work. So B4, and I hope there's some Tasmanians on the line, Annette Fuller, who's been an amazing leader in this space with her colleagues in education in Tassie, have developed some amazing training and resources. And this is all available for free online, where they're using the early years story in their key communications. So you can beg, borrow, steal what they've done and use that in your communications. It's a great way of building on what's already been done using these kind of resources. And I know in Queensland they're using some of the B4 resources as well. Raising Children Network, I'm sure many of you are familiar, but hundreds of thousands of parents visit the Raising Children Network every day. We've changed our language there, and I used to work at the Parenting Research Centre, from, communicating with your children is incredibly important, to explaining, rather than asserting, it's important, explaining what it looks like. So moving from asserting to explaining, and you'll see that right through the Raising Children network now, that there's many more examples of what you do and how you do it rather than asserting the importance of it. The reframing parenting work I've talked a fair bit about already, and thanks to those in the audience who've been doing a brilliant job of putting children first in their communications and then talking about parenting support. This is a significant tool, a metaphor that's been tested and helps the public understand that parenting is not just about an individual endeavour. Parents need to be supported. So children thrive when parents are supported, and what that support looks like is having community supports, good health services, overcoming the stormy seas of financial disadvantage, etc., etc. And it's been used throughout Australia in a number of organisations. I'll just pick out a couple of things here. So FAMS is the one of the peak bodies for family services in New South Wales. It is the peak body, and their strategic plan is using the frames throughout, as is the Bernardo's practice framework. So they're using it in their communication with clients to really make sure they're not othering, that they're helping parents by explaining rather than asserting. And of course, NAPCAN and others have been using these materials. So we've had a number of champions over the last few years who've been on this journey implementing these frames. Now, Naomi, apologies for going over, but I'm just going to now bring you in to talk about some of the practical strategies you've been using in Queensland.
Absolutely. Thank you so much, Annette. It's really great to hear and to hear that we're the breadth across Australia that's already happened beyond we got started here. Before I kick start, I just wanted to also acknowledge that I'm on Turrbal and Yagara land and echo Kieran and Annette's respect to their elders past and present. So I'm just going to briefly talk about what is happening here in Queensland, a little bit about Thriving Kids, and then go into some examples of what's happened so far. So if you aren't aware, Thriving Queensland Kids Partnership, we're focused in Queensland, obviously it's in the name, hosted by RACI and instigated just in 2020, with Michael Hogan as the convener and his colleagues. We have a deliberately optimistic vision to see positive change for all Queensland children to have a great start and journey in life. And we recognise that's going to take time and it's going to take working together, and particularly working with those who share our goal to catalyse systems to change the odds for Queensland's children. So partnership is in the name, and partnership is what we do. So we're working at the intersection of not-for-profits, government, unis, research institutes, philanthropies, to activate collaboration and to strengthen existing efforts of what we already know is working well as fostering innovation to drive this change. And you can see in our tagline, connect, catalyse and learn, and all our endeavours come back to these three things. The work's arranged around a portfolio of 10 interconnected initiatives, and they're targeted at the 6 critical system levers that have been identified and are pictured here on the slide. So why framing? So Michael and others instigating this partnership recognised early on the role messaging plays in shifting how we, the public, and of course we're all part of the public, whatever role we're playing, how we think and feel and act on what's needed for children to achieve our goal. And no matter if we're talking about investments or early years or data, policy, place-based initiatives, we need to be mindful of our audience and purposeful about how we're framing the work. And so with this in mind, the partnership developed the strategic framing initiative as one of the 10 initiatives that is being worked on over this 3-year period. The initiative is jointly led by ourselves, Thriving Kids, as well as Queensland Family Child Commission, and you can see our goal here. So we launched this initiative started last year. The first stage really has been about building momentum for the work. We've established a sponsor group, which is chaired by NAPCAN, one of the champions Annette spoke about already, and the Commission. And members include like the State Library of Queensland, Department of Education, Children's Health Queensland, also Raising Children's Network, as well as the partnership itself. And this group provides guidance and a strategic lens on the direction of the initiative. We've also established a community of practice, which has a really active group of 15 or 20 leaders, practitioners and communicators working together, sharing learnings, challenges. And lastly, we've been fortunate to engage Frameworks as a critical friend and partner to the work. So to support the goal, we've needed to not only learn what are the recommended frames like that Annette has been speaking about, but how do we apply this knowledge in our work while we also support implementation across the wider ecosystem. So what have we been up to? Oops, I think I've gone ahead. And now it's me that's doing that. Oh, what's just happened there? There we go. Sorry, Mike. So what have we been up to? So together we've been building capabilities. We've seen that community of champions emerge from the community of practice. We've done training and built awareness among a wider set of stakeholders and been identifying opportunities and priorities for our next phase. We've hosted workshops, we've held multiple deep dives, we've explored the framing work that's been done before us and been done interstate, such as the B4 work. We've facilitated study groups and we've been listening to our partners and collaborators as they share their challenges and what they share, what they see would support them to deepen and embed their practice. Through the COP, we've been seeing members collaborating together on their own work, bringing things to the COP meetings, and this has resulted in a change of practice and begun to build consistency in our messaging. We've even, at the request of some of our partners, created a bit of a central repository spot where you can find those Australian toolkits Annette was talking about. You can find animations of the tested metaphors, some framing literature that forms a bit of a self-directed learning curriculum for those who want to go a bit deeper into this space, as well as building a portfolio of examples and case studies, and this is available for you. So, but we know we don't just need access to information, but these other activities have been around supporting embedding this work so that it becomes business as usual. So they'll continue on beyond the time frame of this initiative. So I'm going to move on and share a couple of examples that have come out so far. So during the couple of conversations during the community of practice last year, it was identified that Children's Week was coming up. People were starting to think about what they were doing, what they were going to say in Children's Week. And the theme last year was the right to rest and play. And one of the chapters in the Telethon Kids work has been about how we frame play. So it became an ideal opportunity to come together around our messaging. So a working group was formed. Together, we co-designed and brought back to the community of practice a bit of a resource kit around social media tiles and links to associated programs and resources. We worked through what would we do with this? What is our channels of support of impact? And the aim was twofold. We wanted to promote and share the core story of the early childhood and that communication kit from telethons to a wider network of stakeholders who engaged in Children's Week, because we knew not all stakeholders were aware of this pivotal work. I wasn't aware of the work when it was first published and realised how important it is to the work that I was doing even previous to my role at Thriving Kids. And this was shared to more than 1,000 people via newsletters and social media channels. But secondly, we wanted to amplify our key messages around play for children by jointly creating shareable messages that were designed so the COP members could put their own logos on them, so that multiple organisations were sharing them at the same time, building a consistent message and saturating our public framing platforms for that week. The process took expertise in play and children's development, as well as expertise in framing. It drew in media and design skills, it had a robust feedback process, and also took organisational will to participate in this messaging in their role out for Children's Week. So that piece of work was really a combined effort of multiple people in the working together. We've also done some work alongside one of our large statewide services as they've been identifying an opportunity to revisit their language and widen the lens in how they speak about their role in the early years. And this takes a lot of effort from an organisation. So doing this work in any organisation involves leadership, readiness and capability. The senior leaders attended our workshops last year. Some of the team members participated in the study group. And together we explored some international examples of work that had been done elsewhere. And as with any sort of change strategy, if you've been involved, you've got multiple stakeholders that need various different approaches to bring everybody together on the same page. So there's been additional research was brought to the table and further dialogues, internal and external meetings. And I look forward to sharing the results of this as this multi-angle endeavour comes to emerge in the next few months, because it's really exciting to see this piece of work happen. So I wanted to speak to these examples can be both one organisation working together with us to frame up their messaging, or it can be a combined piece. So I'm going to give an example from Thriving Kids ourselves, because we're on our own learning journey of looking back at what we say in our website and what we say about ourselves, but also how when we have opportunity to speak strategically, whether it's through a submission to government or a consultation or advocacy or papers or Michael speaking at a conference, are we using the themes and how we are doing that? So not only do we want to see others, decision makers or communicators using these evidence-based frames, we want to be modelling it ourselves. So recently, for those of you in Queensland and maybe those who scan this sector closely, the Queensland Premier recently released the Putting Queensland Children's First paper for feedback, and it's Queensland's first statewide whole of government draft plan for children. So quite a strategic piece of work. So this, to the left, this LinkedIn post just shows a simple example of how we've used the frames in our call out to join us in providing feedback. We've got what surrounds us shapes us, really wanting to broaden that lens away from the individual and include our collective efforts as we think about children. Let's make sure all Queensland children are given the right environment to thrive now and in the future. So it's a straightforward example of us using the frames, but not only in our call out. So sorry, I just lost my little point. Yeah, so you can see the frames that Annette's has talked about earlier here. But we also have made our submission public, and throughout the submission itself and the recommendations we wrote, we used this language and we looked for opportunities to frame what we were recommending to be in line with this evidence. And others have seen that, picked up on our recommendations and language and used it in their own submissions to the Premier's office. So we don't know yet the result. It's in the first stage of consultation, of course, for this plan, but it's one example of how an organisation has opportunities to use frames in a variety of ways. The second example here is from the Queensland Family and Children's Commission. To Growing Up in Queensland report, which is a biannual report, seeks to provide a really comprehensive picture of the wellbeing of Queensland children and young people. And the text to the side here is from page 8 of the report. The Commission has the responsibility to advocate for the wellbeing and rights of all children and families across Queensland, but has this particular oversight looking at systems like child protection and youth justice. So the experience of children impacted by those systems are amplified in the report alongside the reporting for all children. And so we saw a really great opportunity to use the core story narrative and recommendations here. And if you can read the text, you can see we've avoided otherism. We haven't named which groups are a focus. Instead, we've offered an explanation that some children experience racism, some children experience poverty. So the reasons why particular children might need a different approach to others. We've spoken about health and fairness. We've introduced that idea from conception onwards. We're not just talking about school-age children. And throughout the report, solutions have been highlighted and narratives around how those solutions have worked have been presented parallel with the data that is there for children and young people. And data is something that we can continue to be framing in a way that doesn't spark kind of an overwhelm or a fatalism, but by by marrying it up with some of the solutions and the children's own voices, I think they've done a really great job of balancing that and offering a different frame that sees opportunities for growth. So while we're going to continue, obviously deepening my own and our own learning and skill set, along with the others that are in our collaborating with us, we're moving into a new phase of the initiative that's going to focus a little more on the strategic opportunities for systems change. We have been doing some of that, but we're going to do that more. We're offering a select group of champions a chance of coaching with ourselves and frameworks to really develop messaging around priority areas, so that over time we're going to be able to see these anticipated outcomes of the initiatives emerge. So really excited to see how it's come along so far and where it's going over the next 18 months. I'm really happy to chat with you or touch base if you're interested in this work. And there'll be links to how to make contact with us and links to some of these resources shared with you at the end. So I'm going to hand back to Annette for our final part and opportunity. I'll stop sharing my screen. Thank you. Thanks, everybody.
Thanks, Naomi. That was great. And I was just looking at some of the chat. I don't know why I couldn't respond in the chat, but look, this is incredibly useful for philanthropy, for grant makers, and for applying for grants, because you're using effective language, but also just government colleagues. I should just mention we've had DSS, Victorians and New South Wales governments funding these framing initiatives, because they too have been very passionate and seen how not only do they want to have evidence-based policies and practices, but they want to have evidence-based communications within those things. And it's not to say that you can't talk about particular cohorts and design for those cohorts, but this is about how to move public thinking. So there's a kind of difference between tailoring and designing things for groups that need assistance and support versus how we communicate about those groups. So subtle difference, but I just wanted to make that point. The other thing, Naomi's photos, just to reiterate that visual communication is part of the story, and you'll see how we're moving towards making community part of the story. So again, moving away from individual photos of children to making sure we always have family in those photos, but to have your school in that photo, to have your childcare centre, to have your park in that photo tells the story of our surrounds and our environment shaping us. So don't be nervous about having your service in the photo. You are part of the solution, and the activities in your community are. So making sure our photos don't individualise, but they contextualise. So some key practical tips that I've mentioned before, but just by way of kind of wrapping. Always start with children and what they need for healthy development and well-being. Talk more about health. Talk about learning and development and how that improves health and well-being. Believe it or not, that's quite new. We haven't talked like that before. It sounds subtle, but it's profoundly impactful when it comes to effectively communicating our issues publicly, because the public get investment in health. So putting learning and health together is very powerful. Build understanding of how learning and development actually improves health and well-being, particularly connected to mental health. And this really helps shift public thinking. Show how children's skills develop through an active process of serve and return. The serve and return metaphor is just use it all the time. It really helps people understand how development works, and it's explaining, not asserting. Widen the lens to activate what surrounds us and how important that is in shaping our thinking. Widen the lens to stories of collective effort. How government partners with community and individuals is a very important part of the story. The Australian public actually really get government as partner and appreciate it and want to see that more supported. And use the tools we're sharing with you today. They're there to be used and implemented, and they're only ever as good as your use and uptake of them. So these are the resources. Thank you so much. We will make sure you don't feel you've got to get those down now. We'll put them in the chat, and I think we're just going to distribute them pretty immediately after this conversation. And I'll just finish by saying we all communicate in stories all the time. Let's make sure we're telling a powerful evidence-based story. And as the wonderful writer Toni Morrison said, narrative has never been merely entertainment for me. It is, I believe, one of the principal ways in which we absorb knowledge. So thank you so much for that. We've got a little bit of time for any questions. Please put any questions in the chat. I know we're running a bit short of time, and I know we need to go back to our RACI colleagues. So what we'll do is make sure if there are any questions, we will get back to you with responses to those questions. We're going to have a quick chit chat after this, but I just will take you back to my RACI colleagues for that wrap up and what we're going to do with the questions. Thank you.
Thank you so much, Naomi and Annette. We have kind of run out of time for questions to discuss here now, but if you do have any questions, please do pop them in the chat or in the Q&A section. We'll make sure that we follow up with a response to those following the webinar today. You'll see that another poll has just popped up just to get a little bit of feedback about what you took away from today, and we'd really appreciate it if you would answer that for us. That would be great. Thank you. Thank you for joining us today. The recording of today's session will be available in the coming week on RACI's website and via our YouTube channel, and links shared in the RACI newsletter. If you aren't already subscribed, you can subscribe and be kept up to date with news events and future webinars, and the link should be in the chat box very soon. So once again, thank you so much, Annette and Naomi, for taking the time today to share your knowledge with everyone. We hope that it does lead to positive change for Australia's children and young people and make our lives as professionals working in this sector easier to achieve our aims. I think we'll draw it to a close there. We thank you and look forward to seeing you at our next webinar.
Thank you, everyone.
Thank you.